Joining me now to discuss this further is Mail on Sunday columnist Peter Hitchens, who has described the lockdown as a suicidal panic which will devastate the economy, and also Dr. Simon Clarke, a microbiologist at the University of Reading, who says the alternative to lockdown is a collapse of the healthcare provision. So Peter, just coming to you first of all, we have now surpassed 50,000 deaths in the UK. It's one of the highest rates in Europe. The government are saying this is absolutely necessary, this lockdown, to get on top of that. Why do you disagree with that assessment?
It's a matter of proportion. It always has been. We have had not coronavirus, but winter respiratory diseases in this country on several previous occasions. There was particularly the great Asian flu of the 1950s. There was the Hong Kong flu of 1968-69. These are all tragic. But on no occasion did any government previously think that it was an intelligent or useful reaction to close down the economy and close down a large part of the National Health Service in response. And what baffles me about this occasion is why it suddenly is seen as necessary, especially given that I've yet to see any evidence that these shutdowns actually prevent any deaths. Even those who advocate them have never said any more than that they delay and spread them.
Dr. Simon Clarke, these lockdowns, there's no evidence that they prevent deaths. What do you say to that?
Well, if you look at the rate of people dying, about a fortnight after you have a lockdown, the numbers of infections and the numbers of deaths begin to tail off, begin to level out. So that's the effect of the lockdowns. And that happens wherever they happen. So it's not just an effect of the date, because they don't all come in, don't all start on the same date around the world. So to argue that there's no evidence that they don't slow things down is not particularly true. But you can say that any medical treatment only just delays death. So I mean, I really don't see why that's a valid point. But I mean, it is fair to say that they don't stop people from dying eventually.
Simon, it is the case, isn't it, that we are going to see an increase in excess deaths. In fact, we already are, one of the highest in Europe again. Is this lockdown going to cause more harm than good?
Well, it will cause harm, certainly. Lockdowns are a disaster. I don't think lockdowns are a good thing to have. I've never thought that, and I certainly don't think it now. They are a consequence of, frankly, society's failure. And they're only really put in place to stop the emergency provisions of the health service being swamped. That's really all they're done for.
But they haven't done that. There's no evidence that they've actually achieved this at all. And the health service was never swamped. There's a very interesting article by Fraser Nelson, editor of The Spectator, on the evidence we now have on the supposed first wave, which makes it clear that there was never any serious overloading of the health service in general. There were one or two places where there was pressure, but the health service always comes under pressure every winter from respiratory disease.
Well, this just makes that worse then, doesn't it?
It's a fact. I mean, the King's Fund, a very well-informed and effective think tank, some years ago, established that the British Health Service had far fewer beds and far fewer emergency beds than most other health services. There's been a deliberate plan to make the health service more bare bones than it was before, because they think they can manage it. The fact is that there wasn't any point at which the alleged overwhelming of the health service even seemed likely, and there isn't one now, as far as I can see, either. And people are so widely scared by some quite sophisticated propaganda into believing this thing is so serious. The presumption is taken as read, and it's not challenged. People should challenge presumption. It's the job of intelligent, informed people to challenge what they're told, not to accept it.
Simon, you're an intelligent, informed person. What do you make of that? The NHS isn't, in fact, overwhelmed.
Well, no, because, of course, it was cleared out before it could be. That's why the number of excess deaths is relatively high. So if you send everybody home or don't let them come in for their routine operations, then, of course, it's not going to be overwhelmed. That's part of the problem, because the number of infections that we had meant that you had to do that. Are you seriously telling me you can take 60% of intensive care beds out of use and for it not to have an effect on the
of
normal operation of the NHS.
Of course it has an effect, but it doesn't mean overwhelming. What the government said, it was like a surgeon approached by a man with a verruca on his foot saying, I can cure your verruca by cutting off your leg. And he then cuts off the guy's leg, and of course he hasn't got a verruca anymore. He also hasn't got a leg. The government hugely overreacts. It's like a man who burns down his house because there's a wasp's nest in the roof.
Simon,
a colossal
the government's
overreaction.
overreacting.
Going back to my earlier point, the slowdown in cases, the slowdown in deaths, occurred 2 weeks after the lockdown, like I said. And the reason why it wasn't 4 weeks after the lockdown is because it takes a week or two for people to realise they've got the infection and get tested.
But the government...
That's why.
The government's
so
figures...
the infections had happened about 4 weeks earlier, not 2 weeks earlier.
The government's figures, though, Simon, were... we were told that we could reach 4,000 deaths by December. That has been massively, massively reduced. What do you make of that?
They were not the government's. You mean the more recent data? That silly
Yes.
Cambridge Public Health England graph. That wasn't the government's data, and I'm not here to defend that. That was ridiculous. That should never, ever have been included. I have
it's
no
very
defence
wise
of
of
that.
you not to defend it, but we're talking about April.
But
Peter, just let Simon finish.
It was down to the government's reasonable worst-case scenario calculations. They tell us that those have been breached in terms of the number of hospital admissions for this time of year and met for the number of deaths. Now, we can't comment on that because they won't tell us what that is, and they should do. So actually, saying whether the government's numbers are right or wrong is... Why say it? Because we don't know what they are. We don't know what their numbers are. They won't tell us.
No, I still want to return to the point of causation. What the shutdown of March the 23rd was intended to do was to prevent infection. Then and if the distance between infection and death is approximately 4 weeks, then you cannot attribute a peak of deaths on April the 8th to a shutdown on March the 23rd. You just can't do it.
Yes, you can, because
you can, but you shouldn't.
The infections happened in the week or two beforehand.
The government did not shut down the country to stop people realising that they were ill. It allegedly shut down the country to stop them becoming infected. So it's a 4-week gap we're talking about, and yet it was 2 weeks, or very slightly more than 2 weeks, before deaths peaked. So to attribute the peak of deaths and the subsequent fall to the shutdown is, I'm afraid, impossible.
People had begun to maintain good hand hygiene and social distancing, so that had started to have an effect as well.
Then why have a shutdown?
Because that's not sufficient.
Oh, well, if it's not, why do you argue that it was? You can't have it both ways. Either it led Professor Clark to the peaking of deaths on April the 8th, or it didn't.
If you look at Sweden, they didn't bring their numbers down, and neither did the United States, by nearly as much or nearly as quickly as we did, or other countries that had lockdowns.
We'll leave it there. Dr. Simon Clark, Peter Hitchens, thank you very much for joining me today.
Pleasure.